Before using esketamine, make sure to read the medication guide provided by your pharmacist. To reduce the risk of nausea and vomiting, avoid food for at least 2 hours before treatment, and avoid drinking liquids for at least 30 minutes before treatment. If you have a stuffy nose, ask your doctor if you should use a corticosteroid spray or decongestant drop/spray in your nose at least 1 hour before esketamine treatment. A healthcare professional will give you instructions for how to use the nasal spray device. You may need to use more than one spray device based on your dose. Lean your head back and rest for 5 minutes after using each device. You will be monitored during each treatment and afterward for at least 2 hours. The dosage and treatment schedule are based on your medical condition and response to treatment. Use this medication regularly to get the most benefit from it, and mark your calendar with the treatment dates to help you remember. If you suddenly stop using this medication, you may have withdrawal symptoms. To prevent withdrawal, your doctor may lower your dose slowly. Tell your doctor if your condition does not get better or if it gets worse. Some common side effects of esketamine nasal spray may include problems with thinking clearly, feeling drunk, a feeling of spinning, or nausea, vomiting, dizziness, drowsiness, tiredness, or reduced sense of touch. If any of these effects last or get worse, tell your doctor or pharmacist promptly. Remember that this medication has been prescribed because your doctor has judged that the benefit to you is greater than the risk of side effects. Many people using this medication do not have serious side effects. Tell your doctor right away if you have any serious side effects, including increased urination at night, burning/pain when you urinate, urgent or frequent urination. This medication may raise your blood pressure. An increase in blood pressure can last about 4 hours after a dose of esketamine. Your healthcare professional will check your blood pressure before and after your dose. Get medical help right away if you have any very serious side effects, including chest pain, shortness of breath, sudden severe headache, vision changes, seizures, loss of consciousness. A very serious allergic reaction to this drug is rare. However, get medical help right away if you notice any symptoms of a serious allergic reaction, including rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, trouble breathing. This is not a complete list of possible side effects. If you notice other effects not listed above, contact your doctor or pharmacist. Before using esketamine, make sure to inform your doctor or pharmacist if you have any allergies, as this product may contain inactive ingredients that could cause allergic reactions. It's also important to discuss your medical history, especially if you have any blood vessel problems, high blood pressure, heart disease, or a history of substance use disorder. It's important to note that esketamine may cause dizziness or drowsiness, and using alcohol or marijuana may intensify these effects. Avoid driving or using machinery until the day after a good night's sleep, and limit alcohol consumption. If you are using marijuana, be sure to talk to your doctor about it. Before undergoing surgery, be sure to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant or planning to become pregnant, it's essential to discuss this with your doctor, as esketamine may harm an unborn baby. Reliable forms of birth control should be used while taking this medication. Additionally, esketamine passes into breast milk and may harm a nursing infant, so it is not recommended to breastfeed while using this drug. Be sure to consult your doctor before breastfeeding. It's important to be aware of potential drug interactions when using esketamine 84 mg, 28/3, nasal spray. Certain medications and substances can affect how it works or increase the risk of serious side effects. Make sure to keep a list of all the products you use, including prescription/non-prescription drugs and herbal products, and share it with your doctor and pharmacist. Do not make any changes to your medications without consulting your doctor. Let your doctor or pharmacist know if you are using any other products that may cause drowsiness, such as opioid pain or cough relievers, alcohol, marijuana, drugs for sleep or anxiety, muscle relaxants, or antihistamines. Also, check the labels on all your medicines, including allergy or cough and cold products, as they may contain ingredients that cause drowsiness. Consult your pharmacist to ensure the safe use of these products. When it comes to the daily dosage and optimal timing for esketamine 84 mg, 28/3, nasal spray, follow your doctor's instructions closely. They will provide specific guidance based on your individual needs. If someone has taken too much esketamine and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical help by calling 911 or a poison control center. In the U.S., you can call your local poison control center at 1-800-222-1222, and in Canada, residents can call a provincial poison control center. It's important to remember not to share this medication with anyone else, as it is against the law to do so. Also, make sure to keep all of your medical and lab appointments as directed by your healthcare provider. Make sure to take each dose of esketamine 84 mg, 28/3, nasal spray as directed by your doctor. If you happen to miss a dose, speak with your doctor to determine the best course of action. Do not take a double dose to make up for a missed one. Find a consistent time each day to take your medication and stick to it to ensure the best results. This medication is administered in a medical setting under the supervision of a healthcare professional. It is not meant to be used at home. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.